I'm Larry Menti. Welcome to Another Thing. Eldercare. It's an issue that does not get enough attention, but it will soon. As baby boomers are retiring and they are living longer than any generation. It is a perfect storm of problems for our healthcare system, families, and our budgets. Something has to change before the entire system is overwhelmed. Kolodziej begins our coverage of Eldercare. Ellen.
Experts say that 2/3 of all Americans over 65 will eventually need some kind of long-term health care. Now, whether that's going into a nursing home or trying to stay inside your own home with a nurse's aide, it's very expensive.
I write the checks, and yes, I see the bills, and it's like, what are we going to do? This is where she wants to stay, and it's my commitment to make, if at all possible, to keep her here.
But it's hard.
It's hard. Very hard. Hasn't been an easy road. And we're still traveling it.
I think we're really the way we were during the Depression, because you cannot buy things with the prices they are. This can't keep up.
94-year-old Vivian Cunningham and her niece Mary Rose say paying for all her health care bills is like figuring out a puzzle. Vivian desperately wants to stay in the house she loves, but she needs a nurse's aide 24 hours a day, 7 days a week, and that really adds up. Most aides charge around $20 an hour, so that works out to a whopping $170,000 a year. Now, the average cost of a nursing home in the U.S. is about $92,000, but in our area, it's even higher. In Pennsylvania, it's $113,000, New Jersey, $127,000, and in New York, a year in a nursing home costs $136,000. The Cunninghams took out a reverse mortgage on Vivian's house and feel lucky she can afford to stay here for now, but they know not everyone is so fortunate.
You never know if it will be you or one of your loved ones that needs the care, and you've got to be prepared for it.
You better start looking. That's all I could say. Just start looking while you're working and do it.
Now, a lot of people will tell you you should buy long-term health care insurance, but even those with a policy sometimes come up short and wind up having to sell their house or worse, declare bankruptcy. Reporting for Another Thing, I'm Kolodziej.
Thank you, Ellen. To continue our conversation now on Eldercare, Dr. Mark Pass, geriatrician from Marlborough, New Jersey, and Melissa Chaulker, who is Deputy Director of the New Jersey Foundation for Aging. Thank you so much both for being here. Eldercare is a problem that doesn't get reported. And I say problem because it seems to me that we have a system that is not ready for all of the baby boomers who are going to flood that system. Is that fair to say, Doctor?
Absolutely. The problem is that in the hospital, the rehab, or the assisted living, there's a team of people that can take care of the elder people who are there. Social workers, doctors, nurses, pharmacists, and home health aides, giving people what they need. But when they eventually move home, where they really want to be and need to be, the team doesn't exist so well. People don't have access to the home health aides that they need for personal direct care in their own home, and they can't afford it, and that's where the failure of the system really is.
It's not that they're not available. You have plenty of people available that could come into the homes. It's the way that we deemed as a society what we're going to pay for.
Sure. So, obviously, as we continue to see an increase in the number of older adults in our community because of the baby boomers aging into that age group, we're going to need more people, obviously. That will need to happen. But that's pretty easy to do. What's difficult to do is getting those people to be accessible and affordable for everyone. So the folks that, maybe aren't eligible for programs through their government, such as Medicaid, which might cover a home health aide to come in and can't necessarily afford it out of pocket, are going to be those people in the middle who are going to need that type of care but can't really access it.
And doesn't it behoove us to pay for that? You would think, because what could happen is somebody just gets sicker and they have to go to the hospital, they have to get sicker and they go to a doctor, and maybe the treatment becomes more expensive if we don't have care in the homes to make certain that doesn't happen. It seems illogical that we don't at least come forward and start paying for home professionals to be there, or am I misstating this?
No, you're absolutely correct. Congress, which controls, Medicare and sets the goals and the plans for who gets paid and how they get paid, it doesn't really support home health aides providing direct care to patients in their own homes. So you're right, what Congress is doing is illogical.
I think that these problems arise when politicians get involved. So I hate to hear when you say Congress has to decide this, because I wish it was just people like you, doctors and professionals, that could make those decisions and not have an imposition from above. But I guess that's the world right now.
That's the world right now, and the hope is that the legislators will allow themselves to be informed by the professionals who do this work. I mean, that's why we get the opportunity to testify in front of legislators when there's specific legislation that's being proposed, and why there are lobbyists and advocates out there who try to educate legislators about all these things so that they can make the best decision possible. You
want the change in the Medicare rules so that doctors have more say on how long they can keep their patients. You would like to see it so that home care professionals are covered by insurance. There are two major changes that would help in elder care. Anything else?
I think the third thing that we really agree on is that we need to educate our community as to what services are available right now. Every county has an office on aging. Yes. And many people don't know how to contact them or what services they provide. So if we could get the word out to the people who live around us about what services are available for senior citizens, that would be the third big change that we want.
Absolutely. I mean, there's so much, as you said, even someone who worked in insurance had trouble navigating the system. There's so many things to know and to learn about. And so rather than trying to learn each one of those individual things, I think it's really important for folks to know that the thing that they can do is pick up the phone and call their county office on aging, and the person who answers the phone there is going to really be able to tell them what they need to do in a particular situation and what services are available to them in their county.
And is there enough out there for the caretakers as well? Because it seems to me, as the population lives longer, that many times you have an elderly person taking care of a sicker elderly person, and that's not a great dynamic. There's two lives being ruined. Is there help for them? Is there help for the caretaker in that case?
There are programs that are available for people that are caregivers, respite programs, things like that. But overall, I think that you have a very good point in that oftentimes you have an elderly person who also has health concerns taking care of a sicker person. And so there are certainly multiple effects on the family when it comes to those type of things. And there could be more done.
I think there are a lot of caregiver support groups, a Parkinson's caregiver support group, or an Alzheimer's caregiver support group, or an ALS caregiver support group that are out there, and people need to look for them and find them, because there's other people doing exactly what they're doing. They're being caregivers, they're providing that care in the home because they're a family member, and they need to know, there's other people doing exactly what I'm doing who live in my community. Let me go talk to them and see how they manage and how they cope, and then I won't feel so alone. And usually these support groups are held in our hospitals, sometimes they're in our libraries, but they certainly exist, and they need to be emphasized.
Sure.
And we need people to care. I mean, that's part of it. I think that we all look at it as something that's happening to other people sometimes, and then it's always going to happen to us eventually. Either it's going to be somebody in our family or it's going to be us. So it really is something that we need to address. As I read more about it, I realized what a big issue this is, and it's just not getting the attention it should get. And with the attention is going to come the education. With the attention is going to come the change in policy. So this is a small start, but I hope it gets covered a whole lot more. Thank you so much for being here. I really appreciate it. Dr. Mark Pass, geriatrician in Marlborough, New Jersey, and Melissa Chaulker, who is the Deputy Director of New Jersey Foundation for Aging. We're going to continue the conversation and move on to Social Security and trying to navigate your way around that as well when another thing continues.
The thought of my sons growing up without me inspired me to quit smoking.
I talked to my doctors, and then I threw away all my cigarettes, ashtrays, and lighters.
I started exercising instead of smoking.
Letting my friends online know I was quitting kept me on track.
Staying away from alcohol when I was first quitting was key.
I kept on trying, learned something each time.
Do whatever it takes.
No matter how many times it takes.
We did it. You can too.
For free help, call 1-800-QUIT-NOW.